saline, sterile water, either is fine. If you're doing arthroscopy, it could be, you know, disconnecting your arthroscopy tubing, squirting on it. That's first thing. Just want to get something on the fire as soon as possible. If the circulator's here, they have a separate sterile water inside the cabinets here. You can use that just for a quick throw on fire. If for some reason it did not go out, you gotta take the drapes off the patient. Take the drapes off the patient. If the patient is in the room, the water fire extinguishers are out in the sub-sterile. Those are what you use when there's a patient in the room. Whether the patient has incision open or the patient is in the room, that's what you use firsthand. So you take the drapes off, get the water extinguisher, get the patient first. Make sure the patient's out. The water's not going to hurt them. At that point, if it continues, then at that point, someone should be coming in for help. Contact the charged person, and they'll notify the front desk or front office if it has to be called, or if this will be called overhead. I mean, that's first thing. If it's a fire that you feel like you're not going to be able to put it out, then you call code red to fire to room 1 3 times, and that's when people are going to come in and help and whatnot. If there is no patient in the room, then you can use this extinguisher in here. The one here is fine for everything in the room: electronics, drapes, whatever. And this one is just caustic to the patient's skin and tissue. That's why it's not the first choice. That's why the water is first choice. And it's okay for those to be in the sub-sterile. There's one for each room, so there's 2 in each sub-sterile. So at that point, it's out, and basically you don't have to transfer the patient out. In this scenario, charged person was notified, they came in, they helped. If it was contained, fire department usually doesn't come, and that's it, this one. For electrical fires, anything that you find during the case is sparking, smelling, first thing you want to do, unplug it first, and at that point, the charged person is called, and determine what's going to happen at that point. Make sure that that's disconnected from the patient, unplugged. And having to evacuate is a whole different situation. You evacuate laterally to the pre-op factory area with the guidance and assistance from the charged person. They would give you the okay to do that if you had to. But for just surgical field, any fluid you have on it, first thing, most important. Questions? And just we'll go over a couple of things. PASS, what do you think PASS stands for in regards to a extinguisher?
Pull and squeeze and weed.
Okay, you watched the video, I saw that. About race?
Rescue.
Rescue, contain, evacuate.
Okay, for people who don't know, a typical fire extinguisher is only good for 30 seconds. So that's why it's so important to make sure that you are at the base of the fire, sweeping base of the fire. Because once that 30 seconds is done, that's all you have. So you have to find another one.
What are those water ones good for?
The water ones, I'm not sure. I have to check. I have to check on that one. I thought they were all 30 seconds, but this one's a little bigger. And those only have to be checked once a year, as opposed to the other ones that are checked once a month.
Those get checked once a month,
The other ones,
Really?
the current trend in operating rooms are just having water or carbon dioxide in the operating rooms because these are so caustic. This really shouldn't be used for patients in the room. So I would only use the water. Yeah, so you guys use them. Fire extinguishers, each are like we discussed. The water ones are out there. Fire poles, just so you know, are where?
One at a time. Yeah.
Fire poles are at just the evacuation points. So just 3 evacuation doors over the fire pole there. There's one smoke wall or smoke compartment between our area and the pre-vacuum area. The shut-offs are outside the ORs in the hallway for the ORs, and the ones for the pre-vacuum area are in our hallway on this side. We have to shut off any of the medical gases. Evacuate when instructed by the charge nurse to do so. And if you have to evacuate, you end up going into the office, the MRI building over there, into the parking lot. That's where you'd be evacuating to if you had to. And any other questions? We have to really make sure we follow the 3-minute dry time for preps. Because a lot of times you don't know where the cooling is, especially in total joints. You have the alcohol under the drapes, could be there for an hour, depending on how much you use. Some people like to overuse alcohol. So that's it for me. Any more questions?
Has anybody ever seen a fire anymore?
Got them here.
Oh, fire.
You know, a lot of the fires that I've been involved with were awake patients, you know, doing burr holes, awake burr holes, where there's a lot of patients have masks on, or cooling of alcohol, preps, OV, so those are a couple I've seen. Majority of the other ones I've seen, just like equipment that are sparking, smoking, so pulling the cord on those first and foremost, go from there. Yes. Good,
Thank you.
thank you.
Thank you.
Adjourned.
Excellent job. We are gonna have a fire either Wednesday or one of the days next week.